So many people with glute pain think they have piriformis syndrome. The piriformis muscle is a very specific muscle in your butt cheeks that goes from the sacrum out to the hip. If you had piriformis syndrome, it would be right here shooting down the sciatic nerve, which goes this way. Derrick is a patient from Maryland who's been coming to see us.
I was just searching around on the internet for ways to probably alleviate the pain that I was experiencing. I saw your YouTube ad for piriformis syndrome and thought I'd give it a try.
He's been seeing multiple doctors, he's had cortisone shots. It's helped some of his leg pain, but he still has his butt pain on both sides, which was not located right where the piriformis is. It was located at the tops of his butt cheeks and also at the bottoms. Notice that he's missing the piriformis.
I could only walk for about a half hour before my legs started getting numb and the pain just, I just had to sit down. So I can't run really. It's affecting my golf game. Just, in itself, reason to come get treatment. So probably a year ago, like I said, I've had this probably for two and a half years. And about a year ago, I went to a neurologist and they told me it was stenosis. And I just started with physical therapy, which really, kind of eased the pain for a little bit, but then was right back. I then went and got a cortisone shot. And the first one worked, the second one didn't do anything. So I was trying to look elsewhere for treatment of what was going on, what exactly was going on.
So what he has is stenosis. We explained to him that the butt pain he's having is coming from his L5-S1 stenosis, and it's shooting down to all of these areas in his butt. After 3 treatments of getting his stenosis treated, he's 50% better overall.
I started out about a 7 or 8 at its worst, and probably down to 3 or 4 constant pain, and sometimes it creeps back up there.
He actually came in today to record the testimonial from Maryland, and he's not any better from the last visit he had. We explained to him the process. He did 3 hours of yard work. He was overloading a little bit, spilling out of his bucket. So the process continues.
He explains what's going on, so that you can understand, what's going on with your body. I was diagnosed with stenosis, lumbar stenosis, and I didn't feel like it was just that. Something else had to be going on. That's kind of why I fell into this. And he did confirm that yes, it is stenosis, but there are, all the muscles tightening around there are causing a lot of the pain, which is in fact the case.
We continue to remove the adhesion to unload his stenosis so that the joint isn't taking so much stress. And this is what's going to get him to the 75% permanent relief that we promised him, so that he can feel better and have the life that he wants, and he doesn't continue to get worse as he turns 60, 70, 80 years old.
It's fantastic. I don't think I've ever been in a doctor's office with nicer people. Friendly from the minute you walk in the door. And willing to help. Whoever is here is willing to help. I drive 2 hours and 15 minutes to get here, so I would recommend anyone that has, some pain and doesn't know exactly what's going on to come in and at least get a consultation.